Welcome to Law and Justice. I'm Jane Mulcahy. This is a special series on the topic of how to talk policy and influence people. And today I am so thrilled to be joined by Dr. Stephen Porges. Hi, Steve. How are you?
Fine, Jane. Good to see you again.
Yeah, thanks so much for taking time out of your very busy life to speak to me, Steve. Before we talk about polyvagal theory and why it's important for policymakers and all of us to understand about the vagus nerve, maybe you can tell me a little bit about yourself, Steve, and your own expertise, please.
Sure. Yeah, I developed a polyvagal theory, but I have a long history of being a laboratory research and then moving into clinical areas. I'm currently hold a couple of titles. I'm a distinguished university scientist at Indiana University, where I founded the Traumatic Stress Research Consortium. I'm also hold a position of professor in the Department of Psychiatry at the University of North Carolina. But I've been around for quite a while, and the journey has been an interesting journey. It's a journey from, one might say, more basic research to translation of research into clinical problems, and now the translation of the ideas and the work of the research is really into issues of social policy, institutional organization, and many of the things that the listeners on this podcast might be interested in.
I'm sure they will. I mean, I did training with you and your wife, Dr. Sue Carter, a couple of years ago in Cork before the pandemic. And I'd read about polyvagal theory before that and how it was central to a lot of trauma treatments. But can you tell us, what is the vagus nerve, Steve?
Yeah,
and why do policymakers?
Yeah, I'm going to deal with that, but we're going to do some transformation because we're not going to talk about a nerve. We're going to talk about a system that evolved, and we are mammals. Humans are mammals, and mammals are a product of an evolutionary journey into sociality, if we can visualize that. So we came from asocial reptiles, and suddenly there's social mammals. And mammals, in a sense, need each other to care for each other. They need to have safe places. They need to communicate. And this was really, in a sense, this big switch between reptilian lifestyles and mammalian lifestyles. Basically, it's nurturing your offspring, but it's also being safe enough to be in proximity with a conspecific one of your species. So everything within our human life is really based upon a foundation of this capacity to turn off defense and to be accessible to another, to be safe in the presence of another. So it's a journey towards sociality. And when we lose this capacity to downregulate our defenses, we become asocial, just like the reptiles that were our ancestors. So when we talk about the vagus, and everyone talks about the vagus nerve, and they get misdirected because they think a nerve has intelligence or has decision-making properties. It's just like saying if you have a road between Dublin and Cork, that the road carries all the information, or it is the entity, and really it's what's going in the road or the cable of communication in which there is information going in both directions. With the vagus, it's going from the brain to the visceral organs of the body, and from the visceral organs of the body to the brain. So it's really our nervous system surveillance system of our viscera. It's watching out and regulating us. Now, in the world that we're all into, that is when our body detects cues of threat, there's some basic major functions that change. In a sense, our nervous system basically puts aside its priority to take care of its organs, and then diverts its resources to stay alive as an organism. So we become defensive, but we become defensive at the price of serving the healthful regulation of our organs. So in the world that we're all in, when we talk about chronic stress or trauma, we're also talking about comorbidities, health issues that are associated with all these mental health issues, which are not solely mental health issues. So when you are, in a sense, in these states of threat and defense, the nervous system reorganizes, retunes to produce motor activities, fight or flight, and in some cases, basically shutting down and dissociation, but all at the expense of our organs. So you start finding out that there are all these comorbidities with stress and with trauma. And in your interest, like prison communities where people don't feel safe within it, they have all kinds of gastrointestinal problems, cardiovascular, but primarily the gut. The gut literally tells all. It's like kids who don't want to go to school, they get gut pains because their body is going into this state of profound threat and starting to literally shut down. So in a sense, defecating out of fear is part of this older vagal shutdown response. So the vagus is this connection between the brain and our organs. Through evolution, we ended up with two different distinct vagal pathways. One very much linked to our sociality, because it's basically is recruited with the muscles of the face and head, so that when we are socially engaged and sending cues of accessibility and support, then the vagal activity to our heart starts working, and it downregulates our defenses. So the vagus has this wonderful capacity to project our bodily feelings in our voice and in our facial expression in the one direction, and in the other direction, it turns off our defenses. So when you try to calm your baby or your child or even your spouse, you'll talk to them with a melodic voice, and you'll be gentle and calm, and suddenly the tension and the fears disappear. They're detecting the features in your voice, and that's triggering a physiological shift in their brain that is now sending cues or signals down the vagus to inhibit our sympathetic fight-flight activity. And so the vagus is this critical bidirectional superhighway of information between the brainstem and the organs.
Okay, thank you for that, Steve. It is, for people who are not familiar with this, it's somewhat complicated, and yet it kind of it solves a lot of the mysteries of life and human behavior and malfunction and ill health by understanding it. Do you think that our politicians and policymakers and prison governors and judges and the like and healthcare providers could usefully better understand the nervous system?
Yeah, the problem we're dealing with is the contradiction between intention and truly effective application. So people in different areas, whether they're talking about social policy or teachers or physicians or parents, usually the intentions are good. The issue is the actual applications of that are the manifestation of these intentions tend not to be consistent with what people's nervous systems want. So we're always about fixing things. Something is broken. So school is about evaluation all the time. If you are in graduate school, which I know you've had some experience in that, it's evaluation all the time. If you're a faculty member, it's evaluation all the time. The body interprets evaluation as threat. So you see the evaluation as, I am anxious because I have to write this paper, or I have to get this turned in, or I have to write this grant when you get a little more progressed. The body doesn't discriminate. It says this is threatening. And so the issues, we have to be respectful. When you go to a physician's office and you get tests, same thing. You are anxious about the test results. And if you have something that is atypical, you have a bodily reaction to it. So the tests that you get from the physician, rather than being a shared journey of learning about your body and an empowerment of how you can better regulate it, becomes fear-inducing. And so we treat things wrong. We basically treat humans wrongly. We say, something's wrong with you, it needs to be fixed. We take away from the individual their body's own capacity to make themselves better. So it's because, whether it's through our institution, and this, by the way, and since I'm speaking in Ireland, and many of your people, listeners, will be Irish, there are overlays, because in Ireland, there's a whole history of the Catholic Church and the English there's a whole set of issues of not being good or not being allowing to be who you are. And this is part of what our societies do. They're societies of containment without allowing the interaction with others to support each other. So I really like to say that rather than fixing, we should just listen for a while. We should become a good witness. When we become a good witness, we enable the person we're listening to for their own bodies to come out and be helpful to themselves, as opposed to retracted in states of threat.
Yeah, and it's so interesting you mentioned that, because I'm obviously not a therapist and don't think I'm going to requalify to become one. But I have experienced that with people, that by listening to them and kind of validating whatever it is they're saying and hearing and, you know, respecting them, that there is something that happens there, and you can feel the physiology change and a little bit of calm into their body if they've been distressed. And vice versa, I've had that too if someone's listened to me. So there is a magic in it, and yet we want to sometimes farm our problems out to paid professionals.
We not just to the professionals. We want to fix with medications. We want to fix with surgeries. We want to fix things. We don't want to learn about them. We don't want to respect what they're doing or our body's attempt to try to teach us something. We're trying to fix it. We're trying to contain it. So let's even go back to the issue of anxiety or being stressed, which defines most of the adult population. Actually, it defines virtually all the population. And what do we talk about? How do you manage your stress? Or can we take something to get rid of it? Or what about alcohol? What about substance abuse? What about these ways that we reach to try to regulate our physiology, which is not optimally regulated because we're in a state of threat? So the issue is, how are we not in states of threat? And this is where it all gets confusing, because we're so threat oriented. We think that removing identifiable threats will make us feel safe. Forget it. That's not what our body's asking for. Our body's asking for cues of safety. It's saying, yeah, get rid of the threat. I don't want someone sticking a gun at me, but that's not enough. Or let's put it in the practical world. You have a term paper, or you have a thesis to turn in. When you turn it in, do you think you're going to be a different person? Your anxieties
take some time.
Yeah. Well, let's say maybe an hour, maybe a couple, maybe a day, and suddenly the pattern is reinitiated because you're still not safe. The completion of the action of getting rid of the threat is not sufficient. You want cues of safety, and our society knows little of that. It knows little about supporting, listening, witnessing, enabling others. We're always saying, if I do that, then the person will be lazy, won't do the work. I mean, we have our narratives, but we have to understand that part of our nature is not to be lazy. Our nature is to be curious. That's why the people are listening. That's why you're doing what you're doing. Most people have a great drive to find a pathway to be transformed into something that they were not initially. They want to express themselves at a creative level. And so many people want to be helpful to others. It's really this notion of the core, what it is to be a human. So if we say that our biological imperative is to be connected, we can also say that our core is to be helpful to others.
Yeah, it's so true. And there's a phrase in kind of trauma circles that I quite like about how you don't have to be a therapist to be therapeutic. And that really is around that co-regulation and kindness and compassionate listening. Is that something that the kind of neurophysiology bears out, Steve, that you don't need a doctorate or a double doctorate?
A doctorate, as those of us who've been on a pathway, doesn't necessarily help in enabling your body to feel safe with others, because you start getting into a different role. And the role is that of to evaluate others. And that means you put other people in states of threat. So you have this circularity. And
Okay.
what also would happen, of course, within the world of mental health is therapists wanted to solve the problems of their clients. And they really were not familiar with this concept of the body resolving its own problems or the body healing itself. So they wanted to make not short circuit, but a shortcut to
Mm.
save the person from going through all this rehashing their pains. And they wanted to say, you need to do this. And in fact, many people would go to therapists and say, tell me what to do. And of course, that's not the pathway. And as we kind of like started our little dialogue before, if telling people what to do worked, we would not have anxiety, we would not have depression, suicidal thoughts would just disappear. And what I also like to say that behavioral problems in classrooms would
Mm.
never
Yeah.
exist. So we know that the major question in life has a lot to do with our underlying physiological state and whether or not it is self-regulating or co-regulating with others, or is it in a sense out of control? And when we can't co-regulate, that's when we have problems.
Just on the cues of safety, am I right in understanding that safety at the first instance is established or not in our attachment relationship, Steve?
We can use that concept because I mean, so being safe with the mother is, so if we go into attachment theory, you're putting another layer of psychological constructs on it. But the simplicity of an attached organism is really that it's safe in the presence of another, of in this case, the family, the parent, the caregiver. And you can see it in the bodies of children who are attached or safe. But what you start seeing is that co-regulation occurs before self-regulation occurs. And we have it mixed up within our society. We literally beat up on individuals who can't self-regulate, not realizing that their history, and this now gets more into the attachment world history, their history is that of dysfunctional relationships with those that they should have felt safe with, or one would have hoped that they felt safe with. So a parent who has mental health issues is not going to be a safe individual for the developing child. So the developing child's body is learning that they're not safe in a state of accessibility. They're safer when they are in states of defense. And this is a retuning of their physiology. It makes it difficult for them to be emotionally and socially accessible to others.
And do those early experiences of threat and not feeling safe and kind of cocooned with someone, whether a mom or a dad or other caregiver, do they make it more difficult as we age then to trust other people and kind of be open and accessible,
Well,
as you say?
yes, I think it's obvious. I will also tell you, it's even more uh, critical because I gave a talk at a transdisciplinary conference a couple of weeks ago, and it's all about the notion that being accessible to alternative viewpoints, other ideas.
Mm.
And if we are a fearful culture, or if we individually, as let's say academic culture,
Mm.
if we are fearful, we're not accessible to learn other alternative perspectives. So to, in a sense, cross disciplines is really frightening to some people
Yeah.
because they can be safe within their own niche, which has its
Yeah.
own vocabulary, its own markers of success, its own social network. But now to transcend, to go into another or multiple ones, it's falling into the abyss. It's
Yeah.
uncertainty. And uncertainty is a trigger to a nervous system of threat. So we can say that the metaphors of social behavior are also the same that can be used for intellectual intake. And so you start seeing people hunker down and arguing points that are irrational. But what we're really saying is that safe individuals are not only comfortable with others, they're also comfortable with new ideas.
Yeah, so true, so true. And Steve, you mentioned gut problems and kind of the prison population, maybe mental illness as well, or various mental disorders. Are there other common symptoms or manifestations of a dysregulated nervous system?
Well, you would see a sequence. You would see initially a low threshold to be reactive, high muscle tone, jitteriness, anxiety, hyperanxiety, obsessiveness. Now, obsessive behavior is this valiant attempt to try to create predictability in one's life. So
Right.
we can't think of obsessiveness as being a quote mental disorder, but see that it has some adaptive issues. That when a body is under threat, predictability becomes very important. So completing an action, which is viewed as obsessive, is really saying to the nervous system, I see where it's
I've got
going, and
this.
I'm showing,
Yeah.
yeah, it's predictable. So these different perspectives become very important. But remember, uh, and I think I shared this with you, that when I was in graduate school, I spent one summer as a prison guard.
Yes, you
So,
did. Yeah.
which was very interesting to me to see the world. And it was a county workhouse, but it had felons also locked in a special wing. And I spent time locked in with these individuals and was learning about their lives and learning about their social network and what was important to them. And it was very eye-opening for me. And the issue is those environments are not safe environments. There's, you don't have privacy. Privacy is how humans start to create safe worlds. So they create bathrooms, they create places to eat, smaller rooms, bedrooms. So when a house has all these defined spaces, they're defined spaces that enable our physiology to move out of states of threat to a more relaxed mode. So doing bodily needs in a bathroom, sleeping, or even ingestion and then digesting, as long as our body doesn't have to deal with threat cues from outside, it does really good jobs doing those tasks. So we design structures to enable our body to basically it's co-regulating with the structure, or the structure
Right.
is enabling to do it. Maybe we need to think about prison environments a little more
Yeah.
about doing that. And of course, what is the worst thing in a prison? I don't know if all prisons have them. And these are solitary confinement spaces. And all we need to know is that for a mammal, being isolated is like death. It's the worst thing. So we're now is creating really strong punishments, which in the model of many prisons is an incentive that you behave so you don't go there. But when you're dealing with dysregulated individuals, the thought process and the planning process isn't there. The intention, it's the immediate moment. How do I express what's in my physiology rather than contain it? So outbursts come out, and then you start having individuals placed in restricted areas.
At the training, you said, Steve, that neural state is the intervening variable. And I
Yeah.
use that phrase a lot now. Lots of people won't know what it means. But
Yeah.
how can frontline kind of service providers, whether teachers or prison officers or really anyone who interacts with the public,
Yeah.
understand that?
Well, I guess you first understand it by learning to listen to your own body and to honor it. And so you go inside and say, there are days, times when I feel agitation in my body. I feel physiologically worked up. And when I feel that way, I have a bias. My bias is to be reactive, it's to be evaluative, it's not to be accessible, it's not to be accepting. So we can see it in our own selves. Now, the next question is, does the self-learning work to project it on others? So we're saying that I now know how that feels. And if someone were to say to me, get out of it, you don't have to do that, how would I react to that? Probably say, you don't understand how I'm feeling,
Mm.
and but yet we will do that in our next breath to our kids or to our spouses, we'll say, just stop it.
Mm.
And the issue is, without understanding their physiology is ramped up and they need to be listened, they need to be soothed, they need to be calm. And what we tend to do is, when we see that vulnerability, we go into another evaluation and say, why should I be helpful? They're expressing aggressiveness to us. Why should I be nice to them? So our own body is reacting in a threat response to the threats that are being now thrown at us. So we get into these cycles. And people use metaphors like, they say there should be an adult in the room. And what they're saying is that there needs to be someone who sits back, watches, and listens without making rapid evaluations. Unfortunately, I think we are locked in our culture, and this is not just the American, it's in European, it's the worldwide culture, and that is we tend to have, we tend to interpret, well, I call it a moral veneer. We tend to interpret behavior as being just or unjust behaviors, as opposed to seeing it as expressions of the destabilization of people's physiology.
Yeah, and it's so interesting because the criminal justice system in particular, but as you also mentioned, the school system has a long way to go in understanding neurophysiology and co-regulation.
And actually, let me add one thing. I think medicine does too.
Yeah.
Because when you give people diagnosis and they're scared, they're not remembering anything. Their body has already gone into a threat, and they want someone to help lead them. They want a narrative. They want someone to join them in the journey of solving a problem, which in this case is health. And they tend not to know anything about their own health. So the real part of all these things is the joint journeys of shared information.
It's very true. And I remember at your training too, that there was a lady from healthcare who was talking about even the importance of touch sometimes when someone is distressed in a medical setting, and just putting a hand on someone's to reassure them.
Yeah.
Is that type of thing taught in medical school, and should it be, do you think?
Well, medicine is, okay, you have to go again, look at the history. Modern medicine is really quite new. The notion of treating human beings like machines and trying to fix it with drugs and even surgery is relatively new. Medicine has been oversold. There's a belief that you do the right test, you'll find the problem, and problems are solvable. And the older medicine was really much more of an unknown, but it had a lot to do with the relationship with the physician. The physician was, in a sense, a healer. What was the healer? He was a, quote, an all-knowing, respectful person. But the secrets of healing were exactly what we're talking about, enabling the other person to feel safe in his presence or her presence. And what we did was we threw out the placebo effect, which was very, very powerful because it was the body's own ability to heal itself. And we put in its place a mechanistic treatment model without understanding what we were treating. So we could find acute treatments that worked very well for short periods of time with drugs. And then the system would get smart and recognize the drug, and then it wouldn't work anymore. And we see this in mental health issues. And there was also I would say, an intellectual gap. There was a belief that you could tailor a drug that would be so specific to the given problem in the end organ or in the mental health clinical diagnosis that would only affect that. But the nervous system uses common chemicals to communicate. So you start getting all these systemic effects from these drugs that start giving you other problems. So it's a model, and I'm not against drugs. I think they can play an important role in the acute mode and potentially in the chronic mode. But we have to be more understanding of how the drug is influencing neural feedback loops. So that part we're not really that sophisticated. The models are there. It's just that the education isn't. So you can't expect a physician or a surgeon or a specialist within internal medicine to have an understanding of the bidirectionality between brain and the organs that they're trained in dealing with, because they're not getting any schooling on neural regulation, or if any, it's very little. And so in their mind, the organ is the site of disease. In reality, the organ is the last part that the disease gets manifested.
Yeah.
So, so it's the issue of the regulation changes, and then the end organ starts suffering. But if you can see the neural regulation faltering, then you can start getting into earlier intervention models that are not necessarily drug or surgically dependent. They're basically neural exercises of those systems. And in a way, that's why alternative medicine has found this big inroad, and yoga therapies, which are breathing. So is where people are actually performing neural exercises in these alternative methods, not knowing that they're neural exercises. But if we go back to our earlier part of the discussion, just being with another person and talking to them, co-regulating, is a neural exercise.
And of course, before we switched on the recording, we were talking about COVID-19 and how we're all more deprived of this healing co-regulation because of the pandemic, and how the threat is there, it's real, the threat of the virus. And so it is also a normal kind of predictable response to feel dysregulated or anxious, is it not, Steve?
Yeah, so I wrote this editorial for a psychiatry journal. It was all about the paradoxical effect of the pandemic, and that is, the pandemic's real, it's a real threat, and our body is going into these defensive modes. But through the history of human evolution, we mitigated those threats by interacting with other people. And for virtually all of us, we're very limited in the number of people that we can co-regulate with. And prior to the pandemic, if you were having even difficulties with your spouse, there'd be a friend, there'd be a relative, there'd be someone. And now everything is just contained. And the lucky ones, where you're contained with a spouse or a significant other that you like, and that's but we know you're doing very well, because we know the fragility of families in modern society. And they have to now function in this unit, a unit which is at risk, even in the best of times. So it is creating problems. So it's that paradox. What I wrote about in the article was, we're also living in a unique time, and that is where we have video conferencing.
Yeah.
And video conferencing is not the same as face-to-face, but it's a lot better than texting, email, or a phone call. So I was basically telling people what I do. I wear glasses now when I video conference, so I can see faces better. And so I can pick up the cues. And what's interesting is, and this is a true life example, I hurt my back at the end of June. I twisted reaching for something. It was an excruciating pain for 5 weeks. I'm fine now, but I couldn't get into a bed. But I was doing podcasts and webinars online. And while I was doing it, I was paying free.
That is so weird.
Yeah, so during the social interaction, the hierarchy, this is what polyvagal theory talks about, that when you get this newer ventral mammalian vagus working through social engagement, it downregulates your defenses. And what is pain? Pain is a defense system. And so it just downregulated, no pain. I'm engaged for hours. I'm done, get up, I'm in excruciating pain. So it tells you.
So interesting.
Well, yes, real life examples. So it tells you that talking to people is helpful, that pain can be modified or modulated through our social interactions. It's not the same as don't feel the pain, but you say, well, I'm here, let me hold your hand. No pain.
And you might just forget about it for a while, which
you
is
will.
great.
You will, because the engagement is a different system. So it's not like you're living pain all the time. It's like when you're in social interactions, the portals in which pain get felt or expressed get dampened. And it's quite remarkable. And then I became part of a Wednesday evening think tank on pain, and where there were spinal surgeons who had given up doing surgery because they said it doesn't work for pain. And everything was about group activities, social interaction. Uh, it was all about feeling safe with others. And then their pain disappeared, became
So
pain free.
interesting.
Yeah,
Yeah, so interesting. Well, I'm glad you're doing better. Can I just ask you two more if you have the time? Do you have another
sure,
few minutes, Steve?
sure.
Just these ones now directly kind of relate to my new project, which is a youth justice project. And we're working with young boys and teenagers who are involved in gang-related activity, or might be involved in drug dealing and that type of thing. So causing a lot of harm in the communities that they live in. But many of them might have been from families where there was a lot of stressors and kind of chaos. They might not have known secure attachment or safety as very small kids.
Yeah.
And so we're going to be offering two types of therapy, multisystemic therapy and functional family therapy, and to help the young people and their families. But in terms of measuring elusive soft outcomes, which I think are contingent, or the hard outcomes are contingent on these soft outcomes, can you maybe identify some observable indicators that we could tune into in terms of neural state changes?
Yeah, actually, if you go to my webpage and look at something listed as body scales or body awareness scales, there's a scale called the Body Perception Questionnaire. It has
Okay.
two subscales on autonomic reactivity, and we now have a large database on how that is linked to basically reactions in the world, and it's been a surrogate for measuring physiology. And so going
Okay.
back to your earlier question, and that is, can we get a sense of that intervening variable between the context or stimuli in the world and the individual's response? The intervening variable is their physiological state. And you can get a reasonably good estimate from the questionnaire. So the question would be, is whether your intervention or whatever you're doing shifts their reactions on the questionnaire, and does that lead to the outcomes that you want? The other part that I want to mention is that when you deal with individuals who, in their own history, don't have experiences of trust, and this really is complicated because this is what often happens in children who are taken from their biological parents in the foster children bit. And I've been asking this question about how do you deal with those kids, because most therapies deal with both the bottom up and the top down. And the top down is grab a visualization of a positive moment.
Yeah.
And now you're dealing with children who don't have positive moments. And that makes it very difficult. So a lot of therapies, you have that, you have a positive image of visualization, and you exploit that, because when you start living that visualization or feeling it, it downregulates some of your threat responses. But without those visualizations, you have to literally make new ones. You have to find out what is it that enables that individual to smile, to feel good.
Yeah, and isn't it true that even starting to smile, if you've previously had a very blank face, that's a little shift, or being able to look at someone maybe and hold.
Well, okay, so going specifically and directly at your question, thank you for bringing me back. The intonation of voice will give you a lot of information. If the voice is more melodic and less loud or modulated by volume, so think about amplitude modulation or old AM radio versus FM or frequency modulated. Our nervous system looks for frequency modulation, intonation shifts to enable our bodies to feel safe. When people use volume as their modulator, we pull back. So the frequency modulation gets into the actual template that our nervous system is looking for cues of safety. So vocalizations are important. And the evolutionary history is that the vocalization intonations are coming through the larynx and pharynx, which are regulated by a branch of the vagus nerve to bring you total circuit. So it's literally, we're broadcasting with our voice the vagal influence in our viscera. So when people have more modulated voices, their visceral states are more calmer, which we would know by the, I mean, it's obvious and intuitive, but it's neurophysiologically valid as well. The second part you really understand it as we have to look at the upper part of the face, and that is the smile is up high. It's not in the cheeks. We may think it is, but if we Botox everyone's crow's feet, we'll have trouble understanding actually having any empathy with them or sharing an experience, because the exuberance is put in the upper part of the face. So looking at the upper part of the face, listening to the intonation of the voice, and even looking at the tension in their arms will give you a sense of accessibility. The other part is actually a very interesting metaphor. So we think about defense, we put our hands across our ventral side, and now this becomes accessibility. We're showing our ventral side.
Openness.
So, openness, So it's, but then again, if you think about your dog, if you have dogs, when a dog goes back, it's totally safe with you. So that accessibility is a powerful cue to other mammals.
Thank you, Steve. Just one very final one about the role of community, because the neocortex, I think, developed so that we could collaborate as mammals, and it's key to our social engagement system. But in communities that are under threat, for example, due to serious and persistent drug dealing and the violence that might ensue, can people within the community almost become shut down so that they try to survive?
Well, see, I go well below the cortex and really say, based upon how our brainstem is reacting to the world, there'll be cortical information coming down that shifts brainstem. It's either going to enable us to be accessible, defensive, or shutting down, disappearing, dissociating. So we have two defense systems. One is to fight, and one is to kind of like disappear, dissociate, drop, shut down. And when it gets overwhelming, we have no choice. We can't fight. It's adaptive to shut down. But when those more primitive systems, meaning fight, flight, or shutting down, are recruited, access to those higher cortical areas is greatly compromised. So people become functionally stupid. And we all know that. They can't access, the executive functions, the decision making disappears because they're in survival modes. And we need to respect the survival modes, not to think they're just not important. They're critical, because if you're in them, they're everything. Life or death. And if you ever had an argument with anyone, it's not intellectual. They're in a survival mode. And you're not going to convince them. I always like to say, have you ever won an argument?
No, I haven't. I remember when you said that, and I was going, it's so true. I've never won one.
Well, that doesn't mean you don't argue.
No.
So we know that we're making arguments that could be justified through our personal narrative, but we know they're ineffective in convincing someone who's reacting to our aggressiveness, and they're no longer accessible. So we have to think about, how do we convince others, or how do we enable others to be accessible, to be in a dialogue? And remember, dialogue is co-regulation.
So just with the community, to try and move them out of a shutdown state into kind of towards collaboration and cooperation. Does that require then a sensible police response, or an effective one, to reestablish safety, or is it more about co-regulation?
Well, you have two different things going on there. I mean, so let's start with before we get into calling the police and creating a safe environment on that level, let's talk about how do you get groups out of shutting down? Um, you have to physically move to get out of shutdown. So things like playing, dancing, moving are ways of keeping the body out of shutdown. But dancing and like team sports or play result in this hybrid setting where our social engagement through face-to-face and vocalization keeps our mobilization from being cues of aggression. So there's a difference between dancing and fighting, or team sports and fighting. You can be very aggressive, but it's contained through the social engagement, the face-to-face and the voices. Now, the issue of the what you need as the uh, basal state of the situation, it has to be safe on some level. So that becomes, so we have to start off with the premise that there has to be a removal of intrusive threat. So that's why I think, let's say, recreation centers, when I was growing up, they used to have recreation centers in the different communities. And these were places for teenagers to kind of hang out, and they had a basketball court and they had board games, and, kids were not getting into trouble in the way they're getting, the different, I would actually say different marketplaces. So with a drug culture, there's a marketplace mentality that gets in, and there's all the problems with that. But social interaction is really extremely important for our species.
Okay, Steve. Well, that gives me lots to think about. Thank you so much for your wonderful time and insights, and it's been great reconnecting with you. So thank you for joining me.
Oh, you're quite welcome, Jane. Good to see you again. Stay safe and healthy.
Stay safe and well. Okay. This has been How to Talk Policy and Influence People with me, Jane Mulcahy. Take care, Steve.